T, I appreciate you being online. Ginger, I see you on there. Appreciate you being online too. Darla, I need links to prove this info to my family. Someone I know and love is in the process of getting cancer diagnosis. I want to give them the best chance of survival, and my gut just screams, do not do chemo. Please post the links to these study articles. I will share your video. This is gold. Thank you for sharing this info. Merry Christmas, and hope you have a wonderful and blessed 2018. Darla, I appreciate that. It's Darla Weber, Anthony, so make sure that I get that, and I'll try and make sure that she gets those studies within the week. Hopefully we'll have the links up on the website, but if not, Darla, I'll try and help you sooner than that. Monica says exactly right. Chemotherapy is mustard gas. Ginger, Rachel, no chemo. It will deplete any to conquer the illness. Yep. Chemo causes stem cells to be produced in your body that are cancerous. Cancer stem cells are produced by radiation and chemotherapy. So something that people are currently relying on causes the body to produce stem cells that are cancerous and more aggressive. Rachel says, anyone who of others doing it without chemo. I know several, and that's, Rachel, I don't know if you've listened to previous shows or not. That's the reality of how I became, chiropractor. I guess the man or person I am today is because my aunt had cancer. She went standard medical treatment the first go around, where they cut her entire breast off, did a mastectomy, did chemotherapy, radiation. She just about died from the chemotherapy. That was the primary thing that was killing her. In the end, luckily they stopped it, and they deemed her cancer-free because they couldn't find any cancer because they cut her breast off, so there was nothing detectable on medical tests, but she wasn't healthier. She lived several more years. I think it was around 10 years later that the cancer came back more aggressive on her lungs. I think there were spots in her liver as well. They basically given her a few months to live. 3 to 6 months, I think, was her timeline at that moment. They told her, basically, we can try chemotherapy again, but it's not going to cure you. So she was actually told the truth in that situation, thank God. So, really the doctor let her know that she shouldn't be putting her hope in chemotherapy that it could actually cure her, that she still had a terminal date or a death sentence. So her son was going to chiropractic school, comes home to her, says, you know what, I want you to do this all natural. I think this is the best route for you. I want you to get under chiropractic care. We need to get your body functioning again. One of the pivotal things that made a huge difference in her health was the fact that before she started chiropractic care, she was having about one bowel movement, or she was going number 2 about once per week. So her body was very toxic. She got under chiropractic care. Within a week or 2, she literally starts having diarrhea. So I believe, and I know, that her body was completely catching up. So it's really trying to flush things and detoxify. After she went through that, she even started to cough up black, green phlegm, just junk was coming out of her body. Her body started doing what was necessary to remove and expel toxins and waste products. So she's able to do that. She completely changed her diet. She went almost completely vegan or vegetarian, plant-based diet. She started taking supplements. Back then CBD or hemp oil wasn't available, so she didn't incorporate that, but she did essential oils, she did detoxification regimens. She just was loading up on anti-cancer, fruits or vegetables, like garlic and different things. And she did everything she could to get her body functioning well, and she's still alive today, despite doctors telling her she'd have less than a year, a few months. So, and now I'm a chiropractor. I'm 7.5 years into practice, doing what I love to do, which is see people restored and healthy and well. So my aunt, because of her life almost being lost, that's why I'm doing what I do. That's how I got here. So I know for a fact this stuff can save people's lives. Suzette, are you going to let them make you sick till the day you die? Are you going to have a quality of life? Yep. Ginger, pain and disease management, Anna Grace, do it. It's time. I guess I need to pay attention to some of these comments right as I and going through, because sometimes I'm like, I don't know what context, what was I saying at that moment in time? Gosh. Elise, Nicole Ervick, Massey, I love this doctor. You should watch this and show grandma. Anything could help. Well, Elise, I take it that maybe your grandmother or somebody's grandmother is battling cancer or some sort of illness. I hope and pray that the information, in the reality, I know that sometimes broadcast interrupted, I see on my phone. We good? So sadly, I just, our broadcast may have been interrupted. Maybe it's through my cell phone, but, I hope, I know I put this out here, and there's just no calm way to speak about some of this stuff. Like, when you read this, and you look at the hypocrisy of the FDA, to sit here and waste our taxpayer dollars to go after CBD. Listen, I'm all for them going after companies that are making false claims. But what I want to see is them to do that towards the drug company and anybody the same way. But they're not. They're not. They are approving drugs that have zero effectiveness studies, that we don't even know whether they're safe or not. Fast track approval processes. And patients are having to pay the money for those unproven drugs. And the money they're spending is a whole lot more than the money they would ever spend on CBD oil. How can anybody talk calmly about that? So I understand that some people, I know that some people are probably like, when they're like, hey, I want you to watch this video. He calls himself the Wild Doc. I know that's kind of crazy. Don't be put off by him yet. And I know that he's kind of rough around the edges. He kind of talks harshly about things. He can kind of yell sometimes. He acts goofy at times too. He drinks from a mug that has like an ugly face on it. He calls it his ugly mug. I know that, please just bear with it. Watch it. If you watch all the way through, you'll see the guy's got a lot of great information, but, disregard his hat and feathers and weird antics and stuff like that. Just ignore all that, but you'll learn a lot. I know that people are saying that. I've literally had people I explain that to people. Trish, the VA will only allow 8 chiropractic sessions per year as it is not considered a maintenance for them. Hey, you can have opioids for the rest of your life. Our military members are allowed to have opioids for the rest of their life, every day, like as much practically as they want. Why do I know this? Because I live in a town, Clarksville, Tennessee, which is home of the 101st Airborne, right in the city, Fort Campbell, Kentucky. So do I see military all the time? Do I know firsthand or secondhand, speaking to friends of mine? Guess what? In patients, they can get all the drugs they want. And they can get those drugs for the rest of their life, mailed to them. That's maintenance. An addictive, highly addictive and deadly drug, that is allowed to be maintenance. But you're not allowed to maintain your pain level with chiropractic care. So what do I have to do in my clinic? I utilize the VA to pay for the initial intensive treatment. Here in Clarksville, we're getting the VA to pay for anywhere from 24 visits on. We're getting more than the 8. So Trish, you need to find a better VA doctor because it doesn't, and demand better of your VA wherever you're being treated. Now I had a patient, he's getting so much better, he's off his medications, but what happens is he's at 8 out of 10 pain with all his drugs, and then he's getting out of pain, he comes off his drugs and his pain goes up a little bit. Well, the pain meds were actually masking some of the pain, so he goes up. But then because he's still in this, he's only 2 points lower, he says 6 out of 10, but he's off his meds. The doctor didn't take that into account. And they looked at it and they said, I don't think this chiropractor is really helping you. You only went from an 8 out of 10 pain to a 6 out of 10 pain, so you must not be getting any better. And he had to go back to his doctor after they didn't approve him for more sessions after 12 and say to his doctor, hey, and VA, hey, guess what? I'm actually doing a lot better and I'm off some medication. So that may be why you're not seeing on a piece of paper that I'm doing so much better. It's so darn ridiculous the way the medical system, and again, and if you want to see the research, and there is plenty of it, that chiropractic care for spinal pain and maintenance allows people to live a higher quality of life and less risk of surgery. Spinal maintenance is a must for these people. Dawn says, thank you very much for making this video. I have multiple autoimmune diseases, a rare hemolytic anemia, and use elderberry, garlic, CBD daily amongst other natural remedies. I eat plant-based diet, but not 100% yet, working on it. I have a family history of cancer and multiple nodes in my thyroid. I need to add chiropractic care to my regimen. Thank you, Dawn. Please, I was just going to say, because I was just talking to another individual here today, again, I can just sit there at a coffee shop and I start talking to the barista. I think that's what you call them at the coffee shop, right? Baristas. So I'm talking, and you have to say it like that. If you're going to say barista, you have to say it with some snazz. Barista. So I'm talking to the barista and just talking about vaccines and how this year is so ironic that, you know, it seems like we're giving free vaccine clinics to the children in our school systems, and our health departments are giving these vaccines out for free. And for some reason, more people are vaccinated, but yet for some reason, we're seeing the worst flu epidemic in a very, 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 very long time. So anyways, we're talking about that happened to somebody over here, and we start talking about autoimmune conditions. And so what I explained to her, and I'm hoping she's going to make it here into the clinic, that information I was able to give her, the Atlas vertebra. If you're going to go to a chiropractor, Dawn, find a really good one with very specific work to the upper cervical spine, because to me, I've seen it time and time again. And I love chiropractors in my community. I love that they do great work. They help a lot of people, but I know there's a difference between one chiropractor to the next. Okay, different types of adjustments can be done, different techniques can be studied, so we're not all the same. So I've told people before, I've even told my own patients, like, if I can't help you, which I'll try many different types of techniques, if the one we start to initiate treatment with seems to not be working, we can try different adjustments, different techniques in your body. It's about your body's response. It's not just about a pop or click. It's about the response of the nervous system in the body to the forces of the adjustments applied. So I've seen people going to other chiropractors and coming to me and seeing better results, seeing different results. I've seen people going in for back pain and neck pain and seeing improvements in those conditions under other chiropractic care, another chiropractor's care, and then coming to me and seeing that they had full remission of their rheumatoid arthritis. Seeing that with Crohn's disease, a lot of autoimmune conditions. Why do I see the differences? In my opinion, it's simple. It's that I'm getting very, very specific with the upper cervical spine, because the Atlas has such a huge impact on the brain's ability to be able to communicate to the entire body to recognize self from non-self. An autoimmune condition is when the body cannot recognize our own tissues, and it sends the immune system and triggers the immune system to attack that region in the body. So we have to be very specific with the upper cervical spine. So Dawn, if that helps you in selecting and finding a great chiropractor, and if the first one doesn't help you with that, try another one before you're doing tons of great things. Keep doing those things and work towards finding a good chiropractor. So Melissa, quick. My young son documented military vaccine injured, uses cannabis oil in treating his Crohn's and states it is the only remedy that he knows that helps. Now you can't claim that though. Don't claim that it can help with serious conditions like vaccine injury. It's just Crohn's disease, because the FDA said you're not allowed to claim that. So don't claim that it's actually done what it's done for your son, because the FDA said we're not allowed. Did I mention that we carry this unapproved supplement on my website? I have to make a living too, folks. Come on. Off of unapproved supplements. It's not a drug though, folks. It's just a plant-based medicine. It's got marijuana in it. No, it doesn't. Marijuana is a generic name that the government and big pharma and advocates for control have given it. And the reality is, I had another patient that talked to me last week about that. They're like, my husband was watching your TV show, and he's like, so this guy's, she comes to me. He's like, he'll probably watch this and find out that and figure out that it's him. But anyways, hopefully it doesn't cause any marital issues. Sits there and he's like, so this guy's for marijuana? And I'm like, well, here's the deal. Am I for marijuana? I would rather everybody living a healthy life and not need any supplement. None. Like, I would rather it be a perfect world and everybody's healthy, everybody's well, and that's it. Like, that would be great. That's what I would love. Am I for marijuana? No, I'm for people living a better and healthier life. When I told my patient, I'm like, just go home to your husband and tell him, as a Christian, one of the biggest stances I take in this kind of situation is I don't believe that another man should dictate whether another human being is allowed to use or grow something that God created. And yes, folks, I know that our government somehow believes that the pharmaceutical compositions of this present invention, somehow the government believes that it invented cannabinoids, cannabidiol or CBD. Our government invented it. It didn't invent it, God did. So my opinion, quite frankly, is that I don't believe that I should have the ability, no one should, no human being has the ability to rule and govern over somebody else, like completely dictate whether they can grow, harvest, or utilize a plant that God created for a purpose on this earth. Simple as that. And with the potential benefits of this plant. Folks, do we want to, like, hops, all right? Stuff we make beer out of. All right, now there's gluten-free beers and stuff like that too. You can make rice beer, lots of stuff. You can make elderberry wine. But I believe we should be like, okay, nobody's allowed to drink either. We need to take away grapes. We need to make them illegal because people can make alcohol and get drunk and kill people behind the wheel of a car, do really dumb stuff and hurt other people on alcohol. And there's a lot of things that alcohol does that's not good. So I really think we should make grapes illegal, elderberry illegal, honey illegal because you can make honey wine. It's pretty darn simple. Take champagne yeast in a gallon jug and pour a quart of honey in it. Fill the rest up with water. Take champagne yeast, pour it in, shake it up until the honey and water all mixes together. Put one of those I don't forget what they're called, but they're little corks with the little water so bubbles come through and no air goes in. It all comes out as it ferments. You got honey wine. It's really good stuff. But we should make honey illegal because you could get drunk after you processed honey in that way. What else should we? Lots of stuff on this earth could cause harm if people would use those things inappropriately. And people sit there, and I've even seen it and heard it from the Christian community, is that like marijuana is like evil, that it creates people to be. Evil doesn't come from a plant. Evil comes from the heart. Folks, evil is in us all. We all have that potential. In fact, I do. I would be wrong. I would be a moron to say that I don't have the potential. But you want to know why I believe and why I feel? Is because not to do and carry out evil things in this world. My person would be like, dude, I would love to have as much money as the pharmaceutical industry and not have to work a day in my life, and not have to do anything, not to, just be able to do anything I wanted, travel anywhere I wanted. That'd be cool. That'd be really cool. You know what? Okay. Why do I not do the wrong and evil things that the pharmaceutical industry does to get that money? Because I got God right here too. That's why I feel I do that, or don't do those evil things. Folks, a plant's not going to make us evil. We need to stop blaming plants, blaming other things for the evil in this world. We need to look at who is the person behind the evil. Okay, Angela, where do you get your cannabis oil? So the hemp oil that we get is from Tennessee Homegrown. These guys, they do testing on each one of their batches. Cannabis or hemp oil, industrial hemp is where we have to make this from, because that's the only thing legally grown in the state of Tennessee. But it is derived from a industrial hemp. You cannot spray it, no chemicals, anything like that. You have to test it for those residuals, none of that. So I get them from them because I've really looked at some of the manufacturers, and there's probably great other manufacturers in the region or area in Tennessee that make great product as well. And I believe there are. But I love these guys. These guys are really, really good at what they do. They're knowledgeable. Every single Hemp Growers Association meeting, everybody's asking these guys the questions. So I knew these guys were the best growers, in my opinion, that I could see. So great plants, great products. So that's why I kind of partnered with them, and that's why I chose to carry theirs. And milligram per milligram of CBD, I've seen other products here in my community that are a lot cheaper for a bottle this size. They're selling 10 milligrams for 16 bucks. Meanwhile, this is 500 milligrams for $63. Our bottles are more, but the reality is the milligrams you're getting, and you're not getting those other products that can claim that several thousand milligrams of CBD, because they're isolating the CBD and they're eliminating everything else so that it's a concentrated CBD only. So they don't do that. I want full plant extract. I want full plant. I do not want just CBD, because there's other cannabinoids, chemicals within those plants that are beneficial as well. So that's where, hopefully that helps anybody in understanding where we get ours. Hi there, Doc. My husband tried to use the oil but found it too strong to take. He took a half rice grain, went to bed, then awoke with head spins. He feels he can't take it, then he is meant to work when he needs to work the next day. The people using it need to adjust, just stop, work, and rest. No. Laura Love is this question. So Laura, if you're still online, if you wanted to, quick give me a thumbs up. If not, I hope that you get this information here or somebody else has benefited from it. Since you asked the question about your husband and the response there, to me, sounds like there may be a higher THC concentration in that, if that's his responses. He may try a different product, because different plants grown in different environments are going to have different terpenoids within them, and different terpenoids can help or stimulate sleep or rest, and have different neurological or psychoactive or different effects on an individual. So trying a different, it's almost like, you know, you've got to find this plant works for this person, this plant works for another person, this plant works for that condition, this plant works for another condition. So really at this moment in time, because of the restrictions that our FDA, our medical community has over the production of these hemp oils or cannabis oils, you know, we have to say that you've got to try different products until you find the one that works with your body and is able to help your body with those purposes. But again, it's tough for me to say that. And I do not want to lead people to believe that this is all you have to do, because that's the pharmaceutical way. The drug industry and the pharmaceutical and medical industry, what they do is they convince you, this is chemo, let's say. They convince you that chemotherapy is the only thing you need to do. Just take our chemotherapy, leave it to us. We're gonna medicate you. We're gonna give you the drugs. We're gonna give you the chemo. We're gonna give you the surgery. We're gonna do the things. You don't have to do anything. That is completely wrong. So it would be completely wrong of me to sit here and say that, hey, just take this, do nothing else. So I pray no one has walked away from this video or gone away from this video right now and thought, oh, I'm just going to take cannabis oil and hemp oil, and then I'm going to not have cancer or MS or Alzheimer's disease, and then I'm going to be all better. I don't need to change my diet. I don't need to check if my spinal alignment is what's causing my health condition. You know, you need to seek out a physician that's going to identify underlying causes. Causes. Never is there one single silver bullet that is causing a health condition. Not one, in my opinion. So multiple controlling factors and multiple different strategies must be undertaken to actually completely heal an individual. Melissa, Angela, you can go through a reputable site like the Wild Doc or Natural Food Store. Also, CK Rick Simpson. He also tutorial on making your own. Yes, I can't wait to the day that we can make our own and grow. Everyone on this planet can grow God-based medicines. God invented medicines, not government invented CBD. So, appreciate everybody being online. Lynette, good to see you on here. Haha, wonder why what they say about me then. Trish, yeah, they do push that dope. Indiana is debating CBD as we speak. I'm not familiar with how CBD oil works. Endocannabinoid system within our body helps in the regulation of different different physiological functions, mental health functions, cellular functions, suppression or resistance against cancer functions. Endocannabinoid system is integrated in so many different biological processes in our body that by taking a phytocannabinoid, phytocannabinoids found in things like cannabis, it's able to supplement for when our body cannot produce enough endocannabinoids to be able to run and regulate certain bodily functions. So that's kind of the simplistic way of saying how cannabis or CBD oil could benefit. Happy New Year, Melissa. I appreciate that. I'm going to get going here shortly. So CBD helps me so much. I was on 90 prescription pills a week before that. Most just covered side effects and each other. Gosh. Polly, I am so glad that you shared that with us. She was on 90 different prescribed pills every week, and now it sounds like she must be off most, or if not all of them. Trish, they get mad at me for taking none of their drugs, Trish says. So, doctors, I'm mad at you. Why don't you take my drugs? Stop taking supplements. I want you to take my drugs. It's like, why do they get... The fact that a doctor, I've seen this many times, will get mad at a patient. I've had a patient get off of, like, I forget, her testimony was Lisa's testimony with thyroid issues and things like that. I remember her coming in one time. She was literally like, the doctors were like mad at her for not taking like her cholesterol medication, but yet her blood work was better than it's ever been. So her blood work comes back, it's better than it's ever been, and all of a sudden, I believe it was her. If you can find her testimony, remember, or did we ever get her? Yes, we got her testimony. So I've had patients get off of medications, they're off their meds because their blood pressure's looking better, their bodies, they're doing better, they're off their depression meds. So many different medications patients gotten off in my clinic. And then they go back to their doctors and they do their blood work and they do their checkup and things like that. And the doctor's like, wow, you're looking great, you're doing phenomenal, you're losing weight, you know what? We must have really, one doctor in fact said, we must have really got your drugs right this time. So whatever we're doing, man, it must be really working for you. And the patient goes, well, actually, doc, I've quit all my drugs and I've been doing great. And I'm so glad, the patient's like, I'm so glad that your exam and findings and blood tests actually say that I'm doing great. Because that means what Dr. Brown's been doing for me is actually working according to your test results. And the doctor literally 180 sits there and says, what are you talking about? You're off your drugs. You can't stop your drugs. You need to be taking those drugs. Gets mad at her and then wants to put her on more drugs. Prescribes all the drugs that she was on and then more. And she's like, he just told me I was healthier than my blood tests and findings were better than they've ever been. And he's upset that I'm not taking his drugs. See, that's a doctor that doesn't care about the patient. Many people may perceive that by their lies and the way they act because they're happy that they're on their drugs and they're making money on them. But if a doctor responds that way, that they're unhappy you're not taking drugs, despite you being able to say, listen, I'm taking CBD oil, or I didn't take your Tamiflu because I'm taking Elderberry. You know, if they're upset you're not taking a drug, then they're not treating you. They're nothing but a snake oil salesman. They're mad because they're losing profits. Melissa understands. Good, good. Betsy, everyone here in Utah has the flu. We also have like 98% vaccination rate. Huh. So wonderful. We've got all our vaccines off the shelves. We've gotten a lot of people. Man, we made a lot of profit. Now we're going to make even more profit off of people coming to hospitals and taking all our drug flu medications because the evidence research shows it's on the Wild Doc website. You can go get it. It's pretty cool stuff. It's got a lot of information out there about the what the flu vaccine actually does. According to research, it actually makes you lose your heterosubtopic immunity, which is kind of immune system be able to fight off other flu viruses. So if you get your flu vaccine, you're more likely to get sick. Oh, that study of Mayo Clinic, we make sure we don't talk much about that one. That one was showed that our kids were 300% more likely to wind up in the hospital with flu-related avoid cold-related illnesses if they got the vaccine. Oh, we don't talk much about that one. We just tell people, gotta get your darn vaccines, because if you don't, then you're putting everybody at risk, but not really, because if you get your vaccine, you're actually sicker, and thus you would spread illness more, and then more people would be sick, and we'll just make more profits. That's the way we like to do it. So, quick everybody, stat! We need to ship. How many people live in Utah? We need enough elderberry bottles to ship to Utah immediately. Like, that's the way it should. Like, I've got empty lots all around me. I'm like, elderberry grows just about anywhere. It's one of the easiest plants to grow. Like, it should be growing everywhere. All right, one of the woods that I hunt and I collect mushrooms in, it is covered in elderberry. So much. I mean, I'm like, that one woods could probably supply this entire community with elderberry. Why don't we do that? But nope. Because here's the thing. Again, it's, and even nowadays I see it with supplement people too, like supplement people online, stuff like that. It's like you got to have this freaky deaky Dutch oil from the mountains of God knows where, that it can only be harvested if you ride llamas up into the upper stratosphere, and then once you get there, you harvest it, and no one else can. You only got to get it from us, so you got to buy our expensive. See, I don't believe that. I don't believe there's like this one plant that only grows in this one region in the world that is the only answer for all these health conditions. I believe that God was a little bit smarter than that. That's why I think things like milk thistle, dandelion, elderberry, mushrooms, like there's so many medicinal herbs and plants out there in the world right now that literally anybody living anywhere can practically have access to free medicinal herbs and plants and things that they could help. And that's also why I feel that chiropractic is so beneficial is unless you're by yourself out in the middle of nowhere, the desert maybe, and there's still medicinal plants in the desert, but kind of like moringa actually grows in desert type climates, but in areas and arid regions where there's like, grows through sand practically, you can grow just about anywhere. So pretty cool stuff. But it's like, chiropractic is great because you can just lay your hands on somebody and adjust them. This is all I need to help somebody heal and feel better. All. Plants everywhere in the world. Great. Things, it's a pharmaceutical industry. It's people in the wrong mindset in terms of trying to help people that are trying to convince somebody that you can only get the cure for your condition from me. You can only get it from here. You're not able to access it. You're not able to do it. My purpose, my desire in life right now has gone from just running a chiropractic clinic and helping people individually, which is still a major passion of mine, is to show people all the things and so many of the things that I'll never be able to show all the things, but the reality is show as many possible things that I can that say is God had a plan in the design of this world and this earth. He said, here's the cannabis plant, here's the elderberry plant, here's our mushrooms, here's the dandelion, here's the milk thistle for your liver. You know, it's like showing people that it's like your health cannot be and should never be determined by your financial status, by your financial capability, your financial means at that moment in time. Your health, now granted, there are people that are literally in a wheelchair, that they need somebody else to help them. And that's where a community and that's where people and family need to come together and help people. You know, what if we had a community of people where there's everybody with a backwoods would go out today, right now, and collect every single turkey tail mushroom they can find in their woods, or collect every third plant, which would still give you tons of turkey tail, and then bring it and give it to, and then the community comes together and millions of pounds would probably be produced just doing that, and we'd have all the turkey tail mushrooms to be able to provide that for all the immune deficient patients in the hospital or clinics, and we'd be able to boost their immune system. People get healthier. There's a community coming together to do that kind of stuff. You know, it's like we could help people, and then people would be able to learn, oh, that's somebody brought me that turkey tail mushroom helped me get well with my immune system. So now I'm going to be able to identify it and go find it myself. So then I'm being empowered by learning about these plants and these medicinal products. And I can either pay the farmer to do it, or I can be able to do it myself. And that's what I believe is, ultimately kind of what I want to do. So I appreciate everybody being online right now. I know I kind of ranting and went off on tangents a little bit, but this is our first show back after the holidays. Happy New Year, everybody. Hopefully everybody had a Merry Christmas celebrating Jesus Christ's birthday. Please remember that the only way that we're going to save and change this world right now, if we're going to save lives, we need to share the truth. So don't just like the truth, share the truth. I'm the Wild Doc. Thanks for tuning in. Take care, everybody. Bye-bye.